Well, hello, and it's a pleasure to have the opportunity to meet with my friend, Dr. Laura Roberts. And she is the awardee for the Ethics Prize from the College of International Neuropsychopharmacology. And Laura, I'll turn it over to you for you to do a brief introduction of yourself and just share some of your thoughts with us.
Yeah, thank you so much, Maria. And I really want to thank certainly the people who selected me for this award. I'm very grateful personally, but I really want to thank the organization itself for valuing ethics and inquiry related to ethics and our field. I think too often ethics is seen as a thwarting kind of force in our field rather than an enabling force in our field, bringing about greater scientific work and greater understanding. And so I just think it's wonderful that the organization places value on this area. And you asked me to, I can describe my current job. I have an amazing job. For the last 12 years, I've been the chairman of the Department of Psychiatry and Behavioral Sciences at Stanford. It's been a time of extraordinary growth, and I have this huge portfolio related to advancing science of kind of all forms, from basic to implementation. Fantastic multidisciplinary education programs, amazing education, clinical programs for people across the age spectrum, and lots of different kind of subspecialty areas, and harmonizing work with psychology and psychiatry, and then these amazing kind of community-based programs. And then the leaders that are coming out of this department at this time are phenomenal. And before I was the chair of psychiatry at the Medical College of Wisconsin, and before that I was at University of New Mexico, and I did my education at University of Chicago. And that's part of what I wanted to talk about, is I moved into ethics with this fantastic interdisciplinary intellectual preparation from the University of Chicago. But it wasn't until I started taking care of people primarily with schizophrenia and some trauma-related conditions and depression at the VA in Albuquerque, New Mexico. And there, I took that intellectual preparation to see how there was just this immense need for scientific work to support people living with very severe illnesses. And I really felt like the scientific neglect of people with mental disorders was unconscionable. And to see people using ethics as a reason why they were not doing research to help people with severe and persistent mental illness and significant neurodevelopmental conditions and all that felt wrong to me. And so I was able to bring kind of an evidence-based, empirical, scientific approach to looking at ethical questions in neuropsychiatry and psychopharmacology. And it was a way of giving voice to people with mental illness, and also to help the field itself lean in toward doing more scientific work to address the scientific neglect of these populations that I just felt moved by, and such great admiration for. Our patients are amazing, and what they live with and encounter is so basically unfair, that I really wanted to help the field in any way I could. And it just happened that was my skill set, was in ethics, and I could help in that way.
That's wonderful. Maybe you could tell us a bit about some of the current projects that you're working on.
Sure. So I basically do research on anything I'm doing at the time. So when I was a medical student and had my first child, I became very sensitive to how there are dual role issues when you're a trainee and you're a patient and living with your own health issues. And so I studied health issues, stigma, access to care, special issues in the dual role when you're a medical student or a resident and getting health care. And then when I did my psychiatry residency, I started studying ethical issues in schizophrenia research. And then the more work I did with rural patients in rural communities, I started being very aware of how stigma and the therapeutic relationship, treatment adherence, things are different in rural communities. So then I started studying vulnerable populations in rural communities. And then we were doing genetics research and kind of innovative work at the national laboratories in New Mexico. So then I started looking at doing hypothesis-driven studies of vulnerability that relates to workplace ethics issues. And then more recently, I've been doing work on kind of innovative neuroscience work. So ethics in neuroscience, these incredibly creative, but different kinds of issues that come up in, I don't know, optogenetics, organoid research, neurostimulation, artificial intelligence, algorithmic medicine. So, and then I never give anything up. So I'm still doing all of that. So I'm still doing medical, still doing ethical issues and special issues for physicians, health professionals with their own well-being, personal well-being and life balance, as well as their professional work, sources of impairment, all the way to being recently funded with the BRAIN initiative of NIMH, and just completed a big project and a big book on that. Now I'm mentoring one of my colleagues who is doing a really creative project looking at ethical issues in algorithmic medicine. So, you know, distorting influences and that are ethically important in how we train from population data, these algorithms, the biases that are baked into the algorithms, and then the biases when they're actually applied in practice, and how ethics inquiry in all of these areas ends up, if you can really take it on, it doesn't become a thwarting influence. By being more careful and more rigorous about the ethical dimensions of this work, it actually enables us to do more of it and to bring greater benefit across populations over time. So it's really exciting to see this field develop. I would say research ethics and ethics in psychiatry is really still very underdeveloped. I think there's been amazing work in forensic psychiatry, but in a way that's kind of overshadowed some of what I think would be really brilliant work in ethics. And so I've tried to bring along a number of people, but I do hope that more people will be inspired to look at these issues independent of what's legally permissible, looking fundamentally at the ethics questions. And I also hope that people will continue to do hypothesis-driven research. So not just exploratory work, but work that's really builds in sequence and will answer important questions, like, is there a dividing line for decisional capacity for participation in different kinds of studies? Are there ethically robust study designs that give enough information and answers, but minimize the risk that it poses for the people who participate? Those are empirical questions that we can ask, and I would love to see more people take those on.
That's wonderful. Well, thank you so much for this conversation. And I know that people will be very interested in looking up your work and reading more about these challenges, especially these new areas that you're opening up for us in terms of ethical challenges in neuroscientific research.
Yeah, and
thank you very much.
Yeah, and I'm just going to underscore, it's overcoming those ethical challenges. That's what this work can do. It's help us overcome the challenges that might in the past have been barriers, but now become enablers to doing great work. Thanks so much, Dr. Pando.
Terrific. Thank you.